Okay.
แต่ว่าไม่ตัดได้ Fail. Okay, you've seen this last time, right? Because of our device grows, and then by the same time the data grows. So we need GPU to analyze all this massive data. So the overall way that how SPU is going to connect to GPU is because the whole idea is that decentralized medical device, and then we have all this be distributed worldwide. All this device can generate massive data because each device is localized. So we sort of do parallel processing of acquiring massive healthcare data. And then within a very short time, we can collect all this accurate big data. So the AI here will play a key role in interpreting this data. So I'll go to this main page. I'll come back to this later. Yeah, so because right now we can do 30 items, and later more items can be added to the list, depends on the real application. So what we are going to do with the AI is that there mainly will be more than 5 functions. One is interpretation, because when you've got all these data, they are just numbers. So normal people, they don't know what this number is to be associated with their health condition. So the AI will do the interpretation to tell the people what all this data is all about, how that is going to connect to your health condition. And the second is to do the correlation. Somehow, when we go to hospital, we use big machine, complicated machine to get the critical factors of your body, like the CKD, chronic kidney disease. But in order to get the CKD label, how worse it is, you need to go through a series of examinations in the hospital. Might take hours. So we have trained the AI to associate this factor to a very simple like urine test or just a few blood tests. So we associate this simple test to that key factors. And one of the examples is the CKD to be associated with the urine test items and a few blood test items that you can perform at home. So the accuracy is more than 95%. So if that's the case, we can deploy the system in your home, and you will be able to get the critical all these factors.
Part of the reason for this is that the results using your machine, you can pick out many more nuances in the test results, and it is those nuances that you can use to really correlate, make the connections between the test results and possible diseases. So it actually will really shortcut and enhance the ability to diagnose a variety of diseases.
So that way, the system will heavily rely on AI to do all this correlation. Yes, because all the data that we measure using our system is very accurate. So the AI needs accurate data for the training. So the third is prediction. So once you have all these, you can predict what kind of disease will happen, so that you can prevent it. So after that, you can do handling. Handling means the system will provide you a way to see how to improve your health condition. And another way is the interaction. That means we will use the large language model, so the system will talk to you to retrieve some of the critical factors from you. So this is going to talk to NVIDIA to see how our data and how their system can be able to perform all this. Because right now, worldwide, there's a shortage of doctor. Yeah. So if this can help in terms of health care improvement, we can save a lot of manpower.
Yeah, sure. Because this what this can do in minutes or seconds might take a physical doctor an hour or hours to go through the information. So it really relieves a lot of their workload and therefore allows them to work more efficiently.
And there's a 4th stage of deployment of the whole system. And right now, currently, there's only a few very limited biosignal you can get from person, like only the heart rate, or the blood pressure, or glucose. Very, very little items. And they are all separated devices with separate apps. So we are going to introduce our system. We call it the SPU POCT device. And that device will provide all these test items. And then all that will be consolidated into one channel, data channel to the cloud. So the doctor will get the analysis from the cloud and tell the patient or the person what's the condition is.
So in a way, this is similar to when computers started to be used to put together and correlate drug interaction information. And that has actually saved a lot of lives. Because this way, once with the drug interaction, when the doctor prescribes something and it goes into the system, if there's any potential interactions, they know about it right away. So this is similar to that, but far more beneficial. You get a lot more out of it.
They got more of their electronic health record constantly. And then Okay. So after that, we are going to introduce the AI system. So the previous page talking about the data goes to a cloud center. So in there, we will have an architecture, AI architecture, to using the AI to analyze all your personal health data and do the prediction, handling, things like that. And then we can construct an AI doctor. The previous slide is a real human doctor. But right now with NVIDIA's AI system, we can construct an AI doctor which can interact with the person. So this one will be replaced by the AI system. And then the next, the previous page, we are talking about the SPU POCT, and we will enhance this device to have more AI power on the machine itself. So in certain cases, the machine can handle it. But if you need a larger computing or larger handling, that will send back to the central system for more detailed analysis. And at the same time, we're going to develop an even smaller device, which is like portable, very small, and we call it the SPU POCT mobile. That way you can carry this device with you to go anywhere. And then this device will use a mobile phone to send the data back. In the stage 4, we will add a new device, which is a Doctor AI robot. And this robot will be at your home, talk to you, and tell you how to take care of yourself. And the data will collect by this robot. Yeah. So that will be even more interactive.
Sure, that can also be used to recommend certain modifications. For example, on a day like today when it's very hot, they can tell you drink another 250 cc of water. You know, you're going to need it. Or maybe you went for an extra long walk, so do this to compensate for it. So yeah, there's a lot of suggestions that can be done. Or let's say you know, you've had enough carbohydrates for the day, so you don't need to have more. Or you know, try something that's got a little bit less processed sugar. You know, it can make suggestions that just enhance your health.
Yeah, just like you have a nurse at home.
Yeah. And then for the public applications, we have just talked about this. For the carrier, for the ship, and for the space application, airplane, things like that. The container ship?
Yeah.
Yeah, the word container is spelled wrong.
Oh, this
CONTAINER.
Yeah, this is spelled wrong. Yeah. Okay. Oh yeah. Another one will be put in the ambulance. So before the ambulance reach the hospital, they already sent the vital signals measured to the hospital.
Yeah, that's going to save a lot of lives.
Yeah,
Just that alone would save a lot of lives.
Yeah. And in the hospital, that will be a nurse-centric measurement. So the nurse will carry this device and then go to the patient's place and measure it. So the doctor will get the data right away. They don't have to wait. Yeah, so that's about a few pages that we added.
By the way, right now the hospital that I've been going to, Young General Hospital, which is right around the corner from here, they just got these new wireless devices that they use to check blood sugar, blood pressure, pulse, temperature, and they get all of that, and then they just plug it into the computer, and so all that data is automatically compiled. It seems to me that your system, if it's integrated into that cart, allows them a lot more diagnostic power.
Actually, we already visit a company who is specialized in making this system.
Fantastic.
So we are going to integrate with them. Yeah, so we will provide a whole package. We are in partner with this company.
Fantastic.
23. Another case is when another COVID, something like the COVID happened. When this device is already deployed worldwide, they can get the data immediately, so they can do the control of the spread of the disease very efficiently.
Yeah, because basically you would get real-time
geological
updates on exactly how the virus is spreading.
Yeah.
That could be critical in terms of controlling the onset. It's fantastic.
So this is our overall plan in how to deploy our system in various applications.
Well, that's excellent.
Yeah, I'll send you this file.
Thank you.
Okay. Okay. And this is how we deploy. First, we label and train the AI. Like a certain disease is correlated to certain physical data. We train that to associate all these correlations, and then we have to validate. So we cooperate with many hospitals in Taiwan to test how efficient it is. If it reach a very high accuracy, then the next step is to deploy the model and put it in real application. So that's sort of 3 major steps.
I can't wait until the integration of AI actually finds the correlation between those nuanced results and different diseases. And that's going to revolutionize healthcare. It will. And I can't wait for that to happen. I know it's going to happen. It's got to happen. That's the whole beauty of having a system that can see all those different variables, and then having the AI that can correlate them and come up with things that people never even realized before. It's fantastic.
It will help the human globally.
And if you think about it, is it possible that when a person is at a very young age, they could take a general blood test, and the results of that blood test can be tested on so many different levels, and that based on the results, they can determine the level of risk that person is for any variety of diseases, or if there are any predispositions that they need to be more focused on to prevent those diseases from happening. It's just terrific.
Yeah, especially if you have data from the very young. And constantly build up all this your data so the AI can modulate it.
That's the thing is what you are dealing with here is the ability to not only collect massive amounts of data, but to be able to correlate it in a way that is useful, not just a bunch of random numbers, but actually see what the results are and what the predicted results are going to be as well.
And the AI will give you the suggestions about how to improve your health condition. And you can afterwards constantly monitor it to see whether it actually improved or not.
And the more data you get, the smarter the AI gets, so the more accurate it gets. It's fantastic.
So this is our plan.